Hello, listeners. Today on Fourth Trimester Voices, we are joined by Lauren Barker, founder of Uresta, the first FDA cleared self managed bladder support device designed to address one of the most common and least discussed postpartum issues: bladder leaks. Lauren joins us not only as a visionary entrepreneur, but also as a brand new mom to a baby boy. She is just 6 weeks into her own fourth trimester journey. After leaving a successful finance career, Lauren raised $3 million to bring modern, accessible solutions to women's health. And now she is living the very experience that inspired this mission. In this episode, we're going to talk about the realities of postpartum life. We're going to talk about the deep disconnect between what women are told to expect and what really happens after birth. Lauren offers a rare perspective in that she's both leading a company that's focused on women's recovery and she is personally navigating the fourth trimester. I am so excited to welcome Lauren to the show. So, thank you, Lauren, for joining us on the show today.
I'm so excited to be here. So thank you for having me.
Wonderful. First off, congratulations on baby Grayson.
Thank you. Thank
But
you.
seriously, how are you doing? How are you really doing?
I am having a great postpartum period. I think I was
Wow.
very prepared and very educated. I think, for me, I'm really lucky. Like from a mental health perspective, like I'm in a very good headspace. I have like a really great support system. My mother-in-law is outside right now taking my baby and my dog for a walk. My parents have been very helpful. I had a husband that was able to take off 3 weeks when I first had him. So I think that has played a really big part in my mental health. And I think just prioritizing, I breastfeed and I pump. If I'm not feeling it today, I'll pump and I'll take a little time for myself. I've also been lucky. I've had a fairly easy baby. I'd say recovery wise, I do have my 6 week appointment today with my OB and a meeting with a pelvic floor physio. My recovery's been a little bit longer, but we're getting there. So just trying to be patient with myself and my body.
Would you
Yeah.
say that a lot of the planning and preparation that you did to get to this point happened before you conceived or during pregnancy?
I'm in a unique position in the sense that I work in pelvic health. I don't have medical training around pelvic health, but I've absorbed this industry and learned a lot over the last few years.
Mm.
And so I think going into my pregnancy, I was like, you know what? I'm going to get a pelvic floor physio ahead of time. I had already read a fair bit about birth, but I educated myself more. I did have a doula. I had a birth doula. So I think that played a lot in terms of my preparation for birth and my recovery and setting realistic expectations. Like I think a lot of women, and I'm in that age bracket right now where a lot of my friends are having babies. I know the 6 week mark is not necessarily the green light for working out. I had that expectation. So I'm mentally prepared for that. Whereas like some of my friends sort of think that 6 week is sort of the holy grail in terms of getting back into everything. And that's just not true. So I think I was very informed just of my job and being like exposed to this industry. I'm obviously fascinated by it too. So educating myself was interesting.
Absolutely. Is this your first baby?
This is my first baby.
Oh,
Yeah.
get you hair done, makeup done.
I had my mother-in-law come over an hour ago, so I was able to take a shower, which doesn't always happen. Sometimes I don't brush my teeth till 2 p.m., but today I got to do it first thing in the morning. So,
I love that. And you're giving yourself grace too, which
yeah.
is great.
Yeah.
Tell us a little bit about yourself, Lauren. Who was Lauren before pregnancy? Who is Lauren now that you've had a baby?
That's a really good question. I mean, I'm someone who's really passionate about women in business, women's health. I think that's, it's an industry that is underfunded, under researched. I'm someone who loves to be active. My pre pregnancy self, that's something my husband and I would love to go to workout classes together, work out together. We love to travel. Post pregnancy, Lauren is doing a lot less of those two things, obviously, and it's only been 6 weeks. I think I'm excited to see how I bridge pre-pregnancy Lauren with post-pregnancy Lauren. Building Uresta and growing the business has been a big part of my life, especially the last 4 or 5 years.
Mm.
And now finding out what that new normal is. I recognize 6 weeks I'm working right now, let's be honest, but I'm really lucky that I really enjoy these conversations. So for me, it feels like we're just having coffee and I'm out with a friend. So for me, it's like a mental health break, even though it is, I guess, considered work. Again, like giving myself grace. I was trying to, mostly taking off a few months with like a few exceptions work wise.
Okay, I love that. I love that. You mentioned a little bit about Uresta, and we talked about it at the beginning, but tell us a little bit about what made you come up with Uresta. What was the motivation behind it?
So it was a bit of a serendipitous story. I previously started my career in finance. I was working with companies to raise capital, investors, investing in companies, and it's an industry that doesn't have a lot of women.
Mhm.
And Dr. Farrell, who's the founding physician, inventor of Uresta, was looking for capital. And a colleague connected us to see if I could help him out. It was like, hey, you're a woman. This is a woman's problem. Can you talk to this physician who's invented this product for bladder leakage? I got connected with him and started to learn about Uresta and what it did. And I think through that, I was like, this is really interesting. And then I started talking to women in my life and it was like, hey, bladder leakage, that's something you experience. And then we started to do customer interviews with women that we didn't know. I was just blown away at like how prevalent the issue is. Like there's a lot of medical statistics around how prevalent it is. It's 1 in 3 women after the age of 30, so a lot younger than you would think.
Mhm.
And then 1 in 2 by time of menopause. But having these conversations with women, I was like, this is so common, yet such a quality of life issue. A lot of women I talk to, and I'd be like, hey, have you talked about this with your doctor? And it's like, well, I know it's normal, like they know it's not life threatening. We've all heard the phrase like, laugh till you pee. And I
Mhm.
think those sorts of things sort of like normalize it in a way that, like, oh, you should just suck it up. When I was talking to these women, they were like telling me how, like, I've talked to women who've been like, I've completely given up running, something I used to love to do. Obviously, something that's good for you too, mentally and also physically. I talked to women who told me that they carry extra underwear in their purse, in their drawer at their desk. Women who have bought their house based on the proximity of the bathroom to the bed. And
Oh,
I was like, oh my God, this is a huge issue. And the solutions today are archaic. I'm talking about the fact that like 80% of the women that we chatted with were using either pads or reusable absorbent underwear. At the end of the day, those are just glorified diapers. They weren't doing anything to actually help these women live their life, right?
fix the problem.
And so that real, I think what turned out is just sort of a passion project. Helping Dr. Farrell became like an obsession. I quit my job in late 2019 to partner with him.
Provide a solution because often, especially on this show, we talk about conditions that postpartum moms struggle with. One of the things we don't talk about are bladder leaks. And I think a lot of women normalize it as part of this postpartum initiation. We've seen our parents and our grandparents end up wearing big pads or getting diapers. So we feel like
Right.
it's this progression of life. Since I've been in this work, even after having my baby, I realized it's not normal. You shouldn't be leaking. The problem is a lot of moms don't know that. So they suffer
Right.
in silence. How do you, Lauren, spread that awareness through Uresta? I know we'll come back and talk about how
Mm.
exactly the product works, but I want to
Sure.
talk about in terms of, awareness or like reaching the moms who need to be reached. How do you get the word out that this is not something you have to suffer with?
Something that's been really powerful for us is to have real women share their stories with Uresta. And, it's very brave of them to share their story, but there is nothing more powerful than someone sharing their story. The women that have been willing to do a video testimonial that we can put on our website or on our Instagram page, the number of women that are like, and I'm going to speak to a woman, her name was Susan. She struggled with bladder leakage for decades. She actually got surgery for the issue. Her biggest issue was that she was a runner. She was very passionate about running. And this was ruining her running experience. And she hated leaking. She hated wearing a pad and running in a wet diaper. And so she shared her story. And I cannot tell you how many women have messaged me over the last couple of years and be like, I heard Susan's story and it was identical to mine. And it just clicked and I bought Uresta immediately. And that's because her story was so relatable because it is such a common issue. I think sharing that real perspective, real stories really lets women connect. We also started a Facebook group over a year ago. I now have like 7,000 women in it and it's so active. And it's women helping women, sharing their experiences, and it helps women feel less alone, less isolated. Even though it's such a common issue, women aren't really talking about it. I think it's changing. Younger moms in their 20s and 30s are a lot more comfortable about it.
Yes.
Once you get into your 50s, I see a lot of shame and embarrassment around it. So I think we're just really trying to encourage women to chat with each other because they realize they're not alone in this and that it's actually quite common. The other thing we do is we try our best to apply some humor to it. Because I think if we can apply some humor to it, we can make it a little bit lighter, less serious. And again, I think humor connects people, right? Like if we're all laughing at the same joke, it means that we're all relating to it. So I've partnered with a comedian in the past who specifically as part of her set had jokes on bladder leakage. And she's told me how the audience really connects on those jokes. I think it just shows you, it just helps destigmatize it, right? And shows you how common it is and that you're not alone.
Great, great.
Yeah.
Well, I want you to share a little bit about the device itself.
Sure.
I know we're video, so feel
Yeah.
free to pull it out and
Perfect.
teach us a little bit about how it works and how
Yeah,
it's changing the game for moms who are suffering with leakage.
for sure. This is Uresta. So Uresta is a reusable bladder support. So it is a intervaginally inserted product that is going to stop your leaks. And we're talking about leaks when you cough, laugh, your bladder. This will help support your bladder to stop those leaks from happening, but you can still pee with it in. So this is something you can wear all day and you don't have to take it out to go to the washroom. The biggest use case we would see is women just using it when they exercise. It's totally safe to use all day if that's something you need. This is what you get. This is the Uresta starter kit. You can see there's kind of 3 drawings here, and that's because you will get 3 different sizes. This is what Uresta looks like. So this is kind of small to largest size. And you are going to try the different sizes and assess what works for you because everyone needs a different level of support in their pelvic floor. So the things that you are looking for when you're trying Uresta is, of course, have my leaks stopped. If they haven't, you're going to need a larger size. You are also looking for, can I still pee normally with Uresta in? If you can't, you want to try a smaller size. And of course, it should be comfortable and it should be staying in place. This is kind of what Uresta looks like. Kind of looks a bit like a pacifier, but basically this goes into the vagina fully in. This is a handle to help with removing and inserting. And this bell shape here, this wide shape is actually what's doing all the work to support your urethra and your bladder under those moments of extra pressure. This is sort of our middle size here. We actually come in 5 sizes. You'll note that there was 3 in this box. What's in this box works for 90% of women. We have a very small size and a very large size that we will actually just send to you for free if you need it. It's usually, less than 10% of women who are needing those additional sizes, but we send it to you for free. So yeah, that's the product in a nutshell.
Has there been any research in terms of OBGYN or pelvic floor therapy about the success of
Yeah,
urethra?
totally. We have 4 completed clinical studies. We've also been referenced in a number of medical journals globally. So in our most recent study, which is a really interesting one because it was following a group of younger women and active women. So the study was about, it was like 40-ish women, followed them using Uresta for a year. These were very active women. I think the average age was like 42, very healthy BMIs. These were women who were runners participating in CrossFit, and they used Uresta for a year. In that study, 97% of women saw a reduction in their leaks when using Uresta.
Wow.
and 90% continued to use Uresta after 12 months. And
Wow.
I think that just shows how easy it is to use and how it can seamlessly be part of your daily routine.
Love that. Well, now that you're a mom, you have a different lens when you look
Yeah.
at the product. Obviously, you're 6 weeks postpartum. When can moms start using this postpartum?
Definitely important to go through that 6 week clearance with your OB. That is the baseline for sure.
Mhm.
Of course, we want it to be comfortable too. So if it's something you try and you feel like it's a little uncomfortable, maybe you want to wait a little bit. If you're breastfeeding, your estrogen is low, you might be experiencing some vaginal dryness. You might want to try it with some lubricant to help. But it is something that you can try as soon as you've been cleared and you feel comfortable. We would recommend bringing it up with your OB if you're thinking about trying, like, hey, I read about this pessary. That's the medical term.
Mhm.
It helps with stress incontinence. That's something I'm experiencing. Our studies have shown that this isn't going to make your muscles any weaker or
Mhm.
more reliant. It's just like a support tool, the same way you might wear an ankle brace if you injured your ankle. But you can bring it up with your OB and say, like, what do you think about that? It's an over the counter option. We're working very hard to educate physicians and pelvic floor physios in the US. We're a small team and a startup, so it is, it'll take some time, but we're part of the curriculum of Herman and Wallace, which educates pelvic floor physios. So we're definitely part of the curriculum, part of the discussion. It's just takes some time to make it into kind of mainstream medical practice, but you can bring it up with your pelvic floor physio. If you're a pelvic floor physio or a physician listening today, if you go to our website, there's a button that says talk to, or if you're a healthcare provider, click
Mhm.
here. We will send you samples for your clinic. We will send you all our clinical studies. We will send you a video about Uresta if you're looking to offer it to your patients.
Mhm.
Talk with your pelvic floor physio, see if it's a solution for you. It's for women who are experiencing leaks when coughing, sneezing, laughing, jumping, which can be a postpartum issue, can go away, can be more chronic than that.
Mhm. I love that you provide a solution and thank you for sharing that information. From your experience, what do you think are some of the systemic gaps in how we approach postpartum care right now? And how do we utilize different companies, particularly like yours, to help close these gaps that exist?
That's such a good question. There's so much to think about there. I think there's a lot of focus on women from a fertility perspective as this machine that gives birth, right? And I feel like you go to that 6 week appointment and it's very much focused on how your healing is. The risk of hemorrhaging has gone away. How are your stitches? How have you healed? It's very much making sure we're kind of past the major life threatening possibilities of childbirth,
Right.
right? And I think there's a lot of pressures on OBs, like, oh, they didn't tell me I had prolapse, or they didn't ask me if I was leaking. There's a
Right.
lot of pressure on our physicians. They are very focused on making sure you're okay and baby's okay. Someone said to me yesterday, and I now can't stop thinking about it, was your OB is just medical clearance at 6 weeks, right? And you have to think about the fact that that's their
Mhm.
job, right?
Yes, I
That,
think we're putting pressure on one person to
yes,
get us all the way together. And so that's a disappointment moms face
yes,
when they go to their 6 week appointment. They're hoping, I've made it to 6 weeks.
yeah,
Physically, I better be okay.
right,
Emotionally, all right, check me off all the things. And then they go
right,
home. You're like, my pelvic floor hurts when I have sex with intercourse. I'm
yeah,
still leaking. My back hurts. Like, why isn't all of this getting fixed? I think as a society, we have to change that mentality of like, this person's going to fix everything. We have to be able to point moms in a different direction and say, listen, this is
totally,
a holistic thing. You're going to have to find people and places and companies that are going to help give you a well-rounded healing experience. It's not going to be 6 weeks. It could be
yeah.
1 year. It could be 2 years. It could be 3 years. And so that's really important. Thank you so much for saying that.
Yeah, and I think it's totally right because women then get frustrated, right? They go into that 6 week and they're like, they didn't help me or they didn't point out that I had
Right.
prolapse or this. So there's this frustration and women feel like they're gaslit, right? One of the things I know today when I go to my appointment is I'm going to ask for a referral because if I can get a referral, I can get it covered under my insurance. Now,
Really? You have good
yeah, so I'm in
insurance.
Canada, so things are a little bit different. I'm in Canada, I have private health insurance. We
That's
also have
fine.
our public health insurance, but like my private health insurance would cover my cost of drugs or physiotherapy. If it's considered a birth injury and it's longer, I could possibly get it covered by our public health system. That being said, I've heard about this from women. I'm trying to
Yeah.
navigate the system. I think it should be covered because, I mean, in the UK, in France, you have a baby, seeing a pelvic floor physiotherapist is standard care.
It's
Like
their
part of your recovery, it should be in Canada, it should be in the US. There's just so much that women do not know about their pelvic floor postpartum. And again, expectations at 6 weeks, like you're okay to have intercourse, it's going to be pleasurable, that it's not going to be painful, the expectation that they can go and work out when they really cannot, or that they could be doing more damage to their pelvic floor. I think that would be a huge game changer in how
Mm.
we navigate postpartum from a pelvic health standpoint, for sure.
Absolutely. Super important conversations, right? Your pelvic health is so important and taking care of that. We focus so much on getting our bodies back into shape, and we really don't have a plan of getting our pelvic floor back into shape, right? We have to rehab our pelvic floor because,
Yeah.
we don't want to have issues as we get older into aging because that can really affect our quality of life. Thank you for creating
Yeah.
or bringing Uresta to our mom's attention and also our birth
Right.
workers who can really support their patients in this way and point them to that direction.
Yeah.
Yeah. Well, before you end, I always like to ask our guests to sort of give us three pieces of advice for our moms and just words of wisdom.
Yeah, I mean, I think the first thing I would say is as a new mom and as someone who's in that postpartum period, don't compare yourself. For women who are listening to this podcast that are maybe 6 weeks and they're like, she looks like she has her shit together. As a new mom, as someone who's 6 weeks postpartum, as someone who has lots of friends right now who have just had babies that are in that postpartum period, I think there's like a lot of comparing, not in a negative way or a competitive way, but in a way like, oh, she's working out already. Or it looks like she on Instagram, she left the house for 3 hours and
Right.
I haven't gone for a walk in days, right? So I think there's a lot of just comparing and looking at others and being like, why am I not there? Or I want to be doing that, right? And I think for women who might be listening to this podcast that are like, Lauren's 6 weeks postpartum and she seems like she's working and she has her shit together. Please don't do that because everyone's situation is different, from their birth process to their support systems to their mental health to their baby, right? You might have a baby that is waking up every 45 minutes, right? I'm definitely having a baby that's sleeping and I'm lucky. But if your baby isn't, don't put pressure on yourself. It's really important to not compare your postpartum experience to others. Other, I think, advice is give yourself grace, be patient. I think there's a lot of expectations we set for ourselves. Bounce back culture is deeply flawed in our society. By getting back into working out too soon, you can actually be doing permanent damage to your pelvic floor. So just think of the fact that it took you 40 weeks to build a human and then birth that human. Like you're not in a position at 6 weeks to be going back to where you were physically before pregnancy. So give yourself grace. And yeah, I think the last thing I would say is just there's great communities online
Mhm.
about symptoms you might be experiencing mental health wise or physically,
Mhm.
but I want to empower women to not just tolerate some of those nagging issues. Like I think bladder leakage is a nagging issue. It's annoying. It dictates your life. It can take away the joy from some of the activities that you love. And there's solutions out there. Don't just bite your tongue and suck it up. And I feel like our society has instilled women to sort of tolerate pain or annoying health issues, right? Like incontinence isn't painful, but it's definitely a quality of life issue. So, yeah, seek out solutions, bring it up with your doctor. They aren't the be all end all, like we just discussed, right? But there's pelvic floor physiotherapists. Do some research and advocate for yourself.
Absolutely.
Yeah.
Wonderful, wonderful words. Thank you so much. And, if our listeners or anybody wants to find you, where
Mhm.
can they get in touch with you?
Yeah, so we launched in the US in late 2024.
Mhm.
So we are still a fairly new product. We're available without a prescription. So you don't have to go to your doctor for your pelvic floor physio or anything like that, even though we don't do work with those healthcare providers. But you can purchase Uresta directly through our website. Will be shipped to you within 5 business days. So our website is www.uresta.com, and Uresta is Uresta. So yeah, you can check us out there. You want to purchase the starter kit, which is what I walked you through, that has the 3 sizes. We also offer a 30-day money back guarantee. We have a great customer care team that can answer any questions, and an amazing Facebook group of women navigating this world of pelvic health. Our Facebook group is called the Uresta Insider Group. So check that out as well.
So much. This was so
Thank you for having me.
insightful. Oftentimes, people share stories, whether it's a mom or certain conditions in the birthwork field, but it's always
Yeah.
nice to have a solution. I love that you shared with us what Uresta does, and I know this is going to be game changing for many women. So thank you so much.
Thank you for having me, Dr. Chawla. I appreciate
Are
it.
you navigating pregnancy and postpartum alone? Are you feeling overwhelmed by the lack of support? You're not alone, and you don't have to do this alone. With EM Care to You, I offer personalized in home and telemedicine support designed to guide moms through the challenges of the postpartum period. Whether you need total on call services or periodic check ins in the home, I help women recognize warning signs and I support you as your advocate, and I am here for you the entire step of the way. I want to create a postpartum plan that's all about you, your health, and your recovery. Follow me on Instagram at Dr. Choa for tips, resources, and there you'll find a way to book me. All right? DM me or email me if you have any other questions. Other than that, I'm on all social media platforms under Dr. Choa, DrChowa. Let's build a village of support. Let's give you the hope that you need to get through this period of time. Take care. My name is Dr. Choa, and it's been lovely talking with you all today. Take care.